Thank you, Cindy. We are recording this meeting, so it'll be available to other folks if they need it. So welcome, everyone. Welcome to Appreciative Inquiry, an Appreciative Inquiry Approach to Strategic Planning, brought to you by the Peer Recovery Center of Excellence. We're really excited for today's session. This is part of a two-part series that starts today. Session 2 will occur on February 16th. We're really glad to see everyone here. We had about 150 people registered for this webinar today. So I think we're going to have a really good crowd. I'm just going to, I'm going to back up here and introduce myself. I'm going to introduce myself and sort of introduce our presenters today, and then we will get rolling. Can you all see me okay? I can't see myself. So hopefully I'm in the
gallery
of the camera. Yeah.
Mm-hmm. Yeah.
Okay. All right. So my name is Nell Hurley. I am a steering committee member with the Peer Recovery Center of Excellence. The Peer Recovery Center of Excellence, as you probably know, is a SAMHSA-funded National Center of Excellence. And we've been in operation for just over 2 years now. So what an incredible thing that SAMHSA is supporting and funding peer recovery. And the Peer Recovery Center of Excellence is doing lots of technical support and providing trainings and webinars and all kinds of things to support peer recovery. So this is part of there's 4 kind of core teams within the Peer Recovery Center of Excellence, and the team that I am on is around supporting recovery community organizations. And this series is part of a learning collaborative that is being rolled out by the core team that I work on. So really glad to see everyone here. Just a couple of things to cover before we launch into today's session. One is this, this slide just has a little bit of a disclaimer here. Funding for this initiative was made possible by a grant from SAMHSA. The views expressed and written here do not necessarily reflect the official policies of the Department of Health and Human Services. This is something worth mentioning. It's about language. We know that language has a big impact. Language shapes us. If we want addiction destigmatized, we need a language that's unified. The words we use really do matter. Caution needs to be taken, especially when the disorders concerned are heavily stigmatized as substance use disorders are. So you will notice that our wonderful presenters today, Emily and Brian and Jean, will be using person-centered, strengths-based language. So hope you can pick up on that. And just a little bit here about submitting a request for technical assistance through the Peer Recovery Center of Excellence. This map kind of shows you how it works. We really encourage all of you to reach out to the Peer Recovery Center of Excellence if you are in need of technical support. So basically what that means is that we can help with pretty much anything except providing dollars. We can't give you money, but we are really connected to a whole network of experts out in the field. And if you make a request that we can't cover, chances are we can find the person who can. So you would go to our website, submit a request for technical assistance. Somebody from within the Peer Recovery Center of Excellence would contact you to talk about your request. Then we would create a plan for delivering your technical assistance, whether it's training or kind of one-on-one, consulting, support kind of work. We would deliver the TA, and then you would receive a survey to provide feedback. So it's, I don't know, the word technical assistance sounds so technical, but this is really just, it's just a process for us to help people who are trying to develop or grow peer recovery support services or recovery community organizations. So I hope you will reach out if you have questions. We'd love to help you. That's what we're here for. And then just a few housekeeping notes. Again, this presentation is being recorded. Please mute yourselves when the presenter is speaking. When you speak, please identify yourself by name and work area to help others recognize you. You can submit questions and feedback in the chat box. We'll be monitoring that as we go. You will receive the slides for this presentation via email. And in fact, Cindy Christie from the coordinating center will put a link in the chat that will link you right to a site that has support materials for this session, including the slides.
Yeah, and that's kind of a private landing page for all participants, but it is the links in the chat with all the resources.
Yes, great.
Thanks.
And then finally, we value your feedback. We will provide an evaluation link, I believe, at the end of both sessions, right? Not just at the end of the second session.
Correct.
Please, 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 if you can spare the time, it shouldn't take too long. Submit some feedback. It really helps us out to be able to look at the feedback and make changes where we need to. So that will be there as well. So with that, I'm going to hand it over to our presenters from the Georgia Council for Recovery. New name, I love it. And I will let you guys take it away. Should I go ahead and take my presentation down and let you put yours up, Jean, or how do you want to proceed?
Yeah, that'd be great.
Okay. Hang tight, everyone. You should be good, Jean.
Okay. Sorry, I've been having trouble with the mouse. Oh, that's right. All right, thank you. Sorry about that. It took me half a second. Just by way of brief introduction, my name is Gene Conroy. I'm the Assistant Executive Director of Operations for the Georgia Council for Recovery. And we love saying Georgia Council for Recovery. I really like that name as opposed to our older name. My responsibilities include direct peer services, as well as recovery community organization development, and our peer coach training, which is CARES, Certified Addiction Recovery Empowerment Specialist. I've been with Georgia Council I've been here since 2013 as part-time contractor and went full-time as 2015. But more importantly, I'm also a person in long-term recovery. And for me, that means it's been over 35 years since drugs and alcohol have ruled my life. So kind of without further ado, we can get into our presentation. So as an individual and as a peer, part of our strengths are our lived experience and how we work, how we apply that to the work and as we go forward. So really what we're kind of sharing here is our lived experience as an organization developing into a statewide recovery community organization. And as with so many things, it starts with a building. This is 2 Peachtree Street in Atlanta. There are 15 streets in Atlanta named Peachtree. I don't know if they just like the name or just not that inventive, but this is 2 Peachtree. Sometimes it looks like the land version of the Death Star, but this is the headquarters of the Department of Behavioral Health and Developmental Disabilities. And our executive director, Neil Campbell, was the first SSA for the state of Georgia. And she worked for the Department of Behavioral Health and Developmental Disabilities in the Office of Recovery Transformation. And what she found when she got onto the job was she would walk by rooms like this where people were talking about those people. as if it was still part of the war on drugs, as if they were separated. And Neil realized they were talking about her. They were talking about individuals in recovery. We were those people, and that's what the topic was. And she felt that the voice of recovery was not sitting in that room. And she literally invited herself to all these meetings, whether she had an official invitation or whether she did not have an official invitation. She felt that the voice of recovery had to be there in all their processes. Again, you know, nothing about us without us is a theme that we go forward to and work with consistently in our work. And so she took this attitude on anytime she showed up at boardrooms like these. She invited herself to meetings at the Capitol sometimes when she was uninvited, to raise the voice in recovery in all deliberations affecting us, right? Wherever recovery was spoken, she showed up. And that's a part of our philosophy. And at these discussions, what we were finding was they were not focusing on solutions, they were focusing on the problem, the damage, the negative image, the stigma, reinforcing labeling with every single meeting that they went to. And so a lot of other organizations around the country which had this sort of attitude going forward, well, they would produce billboard campaigns like this, right? What do you think of when you see something like this? Do you feel like you've got hope, or do you feel this is kind of hopeless? This is an ever-ending war on drugs. I mean, we're on meth. We're on it. Does that really give you a sense that we can move forward progressively without fear and with hope? We don't think so. And in a lot of work that we've done 2 billboard campaigns. And so what we do in our billboard campaign is we invited individuals within local communities to tell their story, to be out. This is one of these individuals, and I'm not going to give their name, but not only were they on a billboard, it was a corresponding social media campaign where they could look at their stories and read about their stories. And to date, we've run 2 of these billboard campaigns. To date, we have had over 162 million impressions on this. And this is a message of hope. And this is what we wanted to instill, as opposed to those old stigmatizing labeling approaches that we did. And this is another one. This is a good friend of ours. Her picture was also up in MARTA stations, MARTA being the Metropolitan Transit Authority, and the trains and on the buses. And so it was shared in social media experiences going forward. And what we wanted to do was to change the conversation. We wanted to make sure that the conversation was focused on what was working, not necessarily the problem. So Neil, and like many of us, and myself as well, we come from 12-step traditions, right? And we could apply these principles to help guide our work, but we also had to listen, because what works for me does not necessarily work for you. What worked in my community will not necessarily work in your community. We had to be able to develop an approach that worked in each and every varied community in the state of Georgia. Georgia is the largest state east of the Mississippi. And that's not only part of it in terms of the breadth of demographic points within Georgia is extraordinarily wide. We're in Atlanta, metro area. However, what we do here also has to work in other places, right? So what works in Atlanta will not work in Statesboro. What works in Statesboro will not work in Rome. So what do we do, and how do we develop an approach that can facilitate a building on strengths within each community? So recovery happens within communities, right? Early on in Georgia Council's history, Neil, and she always says that every photo of her has her hand up and her mouth open, and she doesn't know if that's necessarily flattering, but that's the kind of advocate she was. That's the kind of advocate we hope to model ourselves going forward. So we conducted hundreds of listening sessions, and this is one of these, where we were able to speak with individuals and find out what the strengths were within their communities. We also practice what we call intentionally not knowing, right? We don't assume we know what is good and what will work where you are. We wanted to listen, we wanted people to talk about their issues, and we wanted people to build connections within their local communities. And this began to sort of take off. Neil describes it as being the dog that sort of caught the proverbial bumper, right? And So it began to catch on and move forward. This is her dog. The reason her dog is sitting in her chair, her, like us, we are not at our desks that much. We feel that we need to be out in those communities because, again, recovery happens within communities. So we didn't spend much time at our desk. And what we really wanted to do was to develop a spark of hope, right? To move away from the focus on the negativity and what's wrong to potential and towards opportunities. And so how do we do this? And how did we come to this? Well, we early on adopted the philosophy of appreciative inquiry. And this approach, in its essence, seeks to engage stakeholders in self-determined change. It's not for us to determine what is necessary or needed for you. We wanted to facilitate a process that fed on the strengths of these local communities. It was first proposed by David Cooperrider at Case Western Reserve. And it's been practiced around the world for more than a decade, several decades, in nonprofit organizations, businesses, families, schools, healthcare organizations, and even governments use this process. The simple principles behind appreciative inquiry is that within every group, something works. If nothing worked within that group, the group would no longer exist. And also that no problem happens all the time. So the group moves forward within this philosophy by identifying the factors that contribute to their success, rather than studying the reasons for their problems or for their failures or for their setbacks. So it's a forward-focused process. So many of you have heard of a SWOT analysis, for example. We don't necessarily like a SWOT analysis because we don't want to think in terms of threats. So we prefer to use a SOAR analysis, which is strengths, opportunities, aspirations, and results. So it changes the dynamic a little bit. It changes that sort of paradigm a bit to focus on possibility. And so it's different. It's different in the fact that appreciative inquiry focuses on strengths and achievements rather than deficits and problems, really, in a nutshell. And so the ideal sort of appreciative inquiry process is that we get everyone in the room, that is the most complete and diverse group of people who are affected by the topic or the discussion or the changes being made for them. It promotes ownership not only of the process, but it also promotes ownership of the results. And there are 4 Ds here. There were actually 5 Ds now of appreciative inquiry, and Brian will go into much more detail about that, but we're really talking about discovery, dreaming, design, as well as destiny. So that what appreciative inquiry does to us for a practical basis is it informs all of our interactions. So for example, every time that we have a meeting with a group, we start with what's working to support your recovery. We also ask what could be better. And then we don't talk about threats, we talk about what gives you hope moving forward. We use this approach in our CARES training, Certified Addiction Recovery Empowerment Specialists in the state of Georgia, that results in a Certified Peer Specialist Addictive Diseases certification. We began this back in 2011. We are currently now on our 52nd cohort of training. We have nearly 1,000 peers that we have trained today. We also use this philosophy of the 3 questions and appreciative inquiry in our work with local organizations and regional organizations. So we work closely to facilitate recovery community organization development throughout the state. And here you have a picture of what we call a listening session. Recovery champions we have these listening sessions where recovery champions kind of gather and we bring together the widest group, again, the widest group possible affected by the discussion or the topic or the changes that we like to see going forward. And the idea is to create connections and create shared purpose within these groups. At the end, when we gather information and we talk, the last question we ask is, who's not at the table? There's always somebody else who could bring strength to this organization. So within these listening sessions, you'll find peers in recovery, you'll find those who maybe want to create a recovery community organization, you'll find people in 12-step organizations, you'll find first responders, you'll find people in justice, you'll find all these groups who can work together, hospital systems come together within these, to help move the process forward of creating connections to improve recovery within the local community. So there are a lot of questions that we ask, and here are a sample of some of them. You know, what does recovery mean to you? What do you think about when you hear recovery? We embarked on the Georgia Recovery Initiative many years ago with several partners, and that was hundreds of listening sessions throughout the state where we asked similar questions to this. The result of which was the state adopted a definition of recovery, but it wasn't a top-down definition of recovery. It came out of these sessions. It came out of what each community felt recovery meant to them. And it's important to get on that same page. It's important to change, again, that paradigm away from the war on drugs, fear, hopelessness, to hope and solutions and aspirations, right? What state agencies could help you? What could be improved within that, right? What would be most successful to drive this movement, not just statewide, but what would work within your local community? So some organizations decide to, or some groups come out of listening sessions and decide to go a step further and decide that they want to form a recovery community organization. And we have what we call a symposium process. What that is a series of meetings that go forward and events that lead to a recovery symposium. Now, the symposium gathers folks who have worked together and created these connections. So really the symposium itself is a celebration of those connections that have been made within the community. Also, we have exercises within here where we ask specific questions to the audience. So when this event is done, the leaders of this proposed recovery community organization actually have the basis of a strategic plan that is rooted in the strengths and the needs within the community. And a lot of these organizations that have gone through this, most of the organizations actually have gone through this process, have thrived. Some need to, sometimes we have to go into a community maybe 1 or 2 or 3 times because maybe we didn't get everybody who needed to be at the table at that time. It's the process that's important. It's not necessarily the mission or the endpoint going forward, the process of creating connections, because the opposite of addiction is not sobriety. The opposite of addiction is connection. So we don't think we're the Chick-fil-A of recovery. And if you don't know who Chick-fil-A's are, we're not the McDonald's of recovery. We don't feel that we have a boilerplate solution that will fit within your state, within your region, or within your community. We feel that you know best what your strengths are and what opportunities there are to move forward and how we can facilitate that. So we feel more like the Home Depot of recovery within Georgia, where you can do it and we can help, and we can help facilitate that for you. So does anybody, I don't know, maybe somebody can raise a hand, they know what this is? I think, Emily, you knew what this is, right? What is this?
That's a mangrove.
That's a mangrove, right? So mangroves only grow in specific areas. They'll only grow and flourish in these conditions, wet conditions, marshland areas, and they build up the coast and help do that. And then this, Emily, what's that?
Gene, that's a hosta.
Oh, all right. See, I have a brown thumb. My wife is the gardener, but I can really dig holes, and that's my job. But Emily tells me that this is a hosta. And we also know that hostas will only grow and flourish in certain conditions. So we wouldn't want to place a hosta in the biome that a mangrove flourishes, nor would we want to put a mangrove in a biome where a hosta flourishes, because it won't work. There are different needs. There are different strengths within those biomes, just as much as there are different needs and strengths within certain communities. Several years ago, in 2017, we had the opportunity to have our first Building Communities of Recovery grant. And with this grant, we worked very intently with 6 existing and emerging recovery community organizations within the state. We took 2 recovery community organizations and worked with them on a process of expanding their connections as well as strengthening their connections within the communities. Then these first 2 recovery community organizations acted as mentors to the following 4 organizations that came forward. So by the end of the grant, we had centers of learning in various parts of Georgia. And now we can say we have a lot of recovery community organizations that act as mentors for other organizations, because we needed sort of a diversity of solutions, a diversity of experience that a recovery community organization can depend on. Because again, what works in Atlanta will not work in Macon or some other part of the state. We also run a monthly network collaborative of recovery community organizations to help, again, provide training, exchange ideas, celebrate what's working, and create centers of learning, but also to strengthen the connections within each of these recovery community organizations. So by following this approach, we have a certain analogy. So this is bamboo. And what do we know about bamboo? Well, at first it sleeps. The next year it creeps, and then after that it leaps. And we've been fortunate to have sort of an analogous set of growth within our organization, and we really attribute it to following the appreciative inquiry approach. We started with one employee, Neil, in 2008 with no money. She was told she had to raise all her money. So by the time, we've reached this period, we have 46 employees. There are over 45 recovery community organizations within the state. And yeah, our budget looks wonderful and big, but most of that money goes out to the local organizations and to training. So we've been fortunate to have that kind of growth curve. So who are we? And here we're talking about our intent, right? I mean, these are things that we sort of touched on and who we are. It says 1 to 39 employees. No, it's closer to 50 right now, and it's closer to 45 recovery community organizations within the state. Our intent is described in our mission, where it states that we want to increase the impact of recovery within our communities through 4 things. We want to do it through education, we want to do it through advocacy, and we want to do it from training as well as peer recovery support services. And through that, that's kind of what we do. We do recovery community organization development. We have demonstration projects in Northeast Georgia hospital system for peers working in emergency departments as well as neonatal intensive care units, and we're going to embark on a project to bring this out to other recovery community organizations. Emily is working on that right now. We do coach training, but we also do a lot of other support and technical assistance throughout the state, again, to assist, to help those do for themselves, not necessarily for us to impose what we want. We were lucky this past year to get a license plate for the state of Georgia, and I don't know how many we've got out, but we got quite a bit out at this point. So money from that actually helps come back into peer services, and we're grateful for that. So we have this quote by Wayne Dwyer: "Our intention creates our reality." And what did he really mean by this? And in his words, he states that our minds are sometimes restrictive, and they fool us into believing that what we desire is not attainable. However, our intentions are drawn from the heart, and as such, will be limitless. And being conscious of our intention will give us the power to present itself in reality. And I'll leave you with this final quote. When you're surrounded by people who have a passionate commitment around a common purpose, anything is possible.
Thank you, Jean. So at this time, I'm going to introduce myself. My name is Emily Ribblett, and I am also a person in long-term recovery. I see some faces on here that I recognize, and also some organizations that I recognize. So it's really, really, really exciting to be here with you all today. My recovery is much more than abstinence from using drugs and alcohol. Today, I'm a present daughter to my mother. I'm a present mother to my children, and I'm a present grandmother, which is my favorite title. And my favorite group to belong to is the Grandma Club. But I serve as the Director of Education and Curriculum Development for the Georgia Council for Recovery. I've been with the organization since 2017, and I am really just very grateful to be here with you. So what I'd like to do now is, first of all, I want to thank you all for taking time out of your day to be here. And I'm going to share with you the agenda. So we're just going to briefly go down through the agenda. Please let me know if you're not able to see this. And you should have a copy of this. And you should have been sent a copy of this. And I want to again thank the Minnesota Peer Center, Peer Recovery Center of Excellence. Thank you, Nell. Thank you, Cindy. And thank you, Chris. We really appreciate this opportunity. So for
Emily,
today, yeah.
Sorry to interrupt. It's a little bit small on my
Okay,
screen.
we'll
Is
make
there
it-
any way that you can make it
Sure
bigger?
can. Oh, and then just make it smaller. How about that?
Yeah, that's better. Thanks.
All right. Sorry about that. Again, so we've already covered Jean going over the Georgia story, and that's just to give you an idea of who we are and what worked well for us. But what we're going to do next is we're going to have Brian Kite introduce himself, and he's going to talk a bit about giving an introduction into the Appreciative Inquiry Approach and the assumptions that go along with it and the philosophy behind it. And then we're going to work in together as a team to define our purpose and map strengths. So that's going to be an activity. The rest of the time we're together, we're going to have you in activities because that's what we're here to do, is to help you all. And we're going to journal, and then we're going to share. And the catchphrase for that section is people support what they help create, which I think probably most of you have heard. And if you haven't, it's a great slogan for the work that we do as peer recovery support providers. And then we're going to talk a little bit about sharing strengths, defining values, and guiding principles. And we're going to journal a high point story. So at this point, I want you guys to keep in mind that this is where you'll need to have some type of a writing utensil and something to write on. That we did supply you with a workbook that you were welcome to use. It's yours. And if you weren't able to print it out, just have a tablet or a notebook, whatever you feel comfortable journaling in. But we really definitely encourage you to participate. And then we're going to share some of that information, share these stories, and then we'll have closing remarks. And then I'm going to give you guys some homework. And it's not difficult homework, it's to help you, but we'll go over that at the end of the session. So, and then in day 2, we'll come back on the 16th and we'll go through the homework, we'll review it, and we'll talk some more about how we build off of strengths, define some values and guiding principles. We're going to go back through some things that you did today and then kind of pull it all together. And the catchphrase for that would be people want to be heard, not fixed, and that recovery is the expectation. So we're going to come up with some opportunity areas where we're going to have a world of collaboration journal time, and we're going to be able to share some of that, collaborate your thoughts and ideas as in groups, come up with some 3 or 4 ideas, really top ideas that stand out as far as how collaboration can really benefit and the work that you're doing. And again, recovery happens in communities where people can access services and supports that are meaningful to them. So then at the end of the day, on the 16th, we're going to try to pull it all together and construct some solid, doable action plans that are achievable. And hopefully you guys will come up with some really good ideas, and we can't wait to hear what you have to share. So without further ado, I'm going to go ahead and stop my share of the screen. At this time, if you do have any questions at all, please put them in the chat, and we'll do our best to address those as we go. And I'm going to turn it over to Brian Kite, let him introduce himself, and we're going to have an activity with a pair share or dyad. So we're going to break you out into breakout rooms of 2 for this first exercise. Brian?
Awesome. Thank you, Emily. As Emily said, my name is Brian Kite. I am a person in long-term recovery. For me, that means as of last week, I celebrate 8 years in recovery. And it's been amazing. Recovery is so much more than just abstinence from drugs and alcohol. For me, it means that my life is extremely more fulfilling, filled with joy and happiness today. I'm able to be a present father to my 9-year-old son. He knows that when daddy says that he's going to do something, he's able to show up and be there with him. We went to the library the other day, and we got plenty of books for us to do some reading over this week. I'm also a better brother, uncle, son, family member, community member, and employee for the Georgia Council of Recovery. For the past 4 years, I have been working for them as the RCO Development program manager. If you're not familiar with recovery community organizations, I hope you will be soon, and feel free to go to our website or find out more information about them. I'm sure most of you probably on this call are. And if you want some further reading about some of the stuff that we're going to be talking about, I'm about to drop some stuff in the chat for you. Don't worry about looking at it this time, but if you want to get some books to check out, here's just a few that have helped us and people that come and work for us understand a little bit more about appreciative inquiry and the science and theory behind it, and how effective it has been to help transform the recovery community here in Georgia. So I'm going to go ahead and jump right in here. Gene mentioned, he shared about the 4D cycle. Really, there are five Ds in this cycle, and one of them being to define. And it is a very important piece. And so we need to understand for ourselves who we are, what we're trying to seek out and explore. And so what are we inquiring into? Are we trying to be develop a recovery community organization? Are we trying to just have effective change in our recovery community, reduce stigma? What is it that we are, and who are we as our purpose? You know, we need to understand ourselves personally, and then what we're trying to do if we're making some organizational or system change. For us together on this call, and then for those that hopefully are able to join us on the 16th for day 2, what we will be working on today is discovering, understanding the best of what is, and maybe best of what was. And then in the future, on the day 2, we're going to jump into dreaming about what could be and designing what should be. Now, that last D is for you to carry out on your own or with your other members of your organization about what will be. And that is, it's something that I think that hopefully as a group, or maybe perhaps you can check in with the Peer Center of Excellence as moving forward, or check in like how your strategic plan or personal plan, if you just develop it for yourself, is going. I'm going to share just a little bit about some of the appreciative inquiry assumptions. Now, this is also in your workbook. If you want to follow along, you can feel free to do that. But these are just some assumptions about appreciative inquiry, just to have you a little bit deeper understanding about what the work is and why we believe that it is effective. Gene already stated this, that in every society, organization, or group, that something works. And we also believe that what we focus on becomes our reality, and the language that we use helps create our reality. Because we know that when we give attention to certain aspects of organizational life, that those aspects tend to define the whole. And the reality of an organization is defined by whatever participants think about, they talk about, they work on, dream about, or plan. And so AI teaches us that we don't need to dismiss those serious challenges that we face, but what we should do is refocus attention, giving energy and priority to positive narratives so that we can become a different organization. Now, reality is also created in the moment, and there's multiple realities. Each person is different within an organization, so my reality may not be my coworker's reality, and there's multiple perspectives that we need to have recognized. And now this next assumption is probably one of the most important, I believe, of appreciative inquiry. According to Dr. Ron Fry, who I was able to meet last year at Case Western University, he was the PhD advisor for Dr. David Cooperrider when he was developing appreciative inquiry. He stated that one of the most important pieces of appreciative inquiry is the inquiring. Yes, it's great to be appreciative and focus on the strengths building process of it, but the act of asking questions, curiously engaging and having a desire to know more is the most important piece that we need to remember in this process. Also, people have more confidence and comfort journeying forward into the future when they're able to carry parts of the past with them. It's scary going into the unknown, and so we want some things that are comfortable, and generally that's things that we have known. But if we do carry parts of the past forward, they need to be the best of what was. And again, it's also always important to value our differences. How can we have everyone's voice heard? It's often a challenge to do this in organizations, to have everyone's voice heard, or everyone think that or feel valued, not just think, but feel valued. So how we're going to do that together, and how we tend to do this with organizations, is a few different ways. We have to understand that a lot of people learn differently, and some people are introverts, some people are extroverts. Okay, so how can we engage all 47 of us on this call together to make sure that our voices are heard and seen? So we're going to do a couple different things, and one of them will just be reflecting or journaling, actually, and then we'll reflect afterwards, but we're going to share. And then lastly, then we will reflect. So you'll have yourself, obviously, you're able to journal, and then at certain times we'll do pair shares or smaller group shares. And then, okay, then we can have our group shares where different groups are giving back together and sharing. And then we'll all share that collective wisdom together. And that way, everyone's voice, everyone's wisdom is used in this process. And so we're able to get the feedback from everyone. Everyone's voice feels heard. And sometimes it can happen very rapidly. That's what AI or this particular approach is about. So whether it's about developing a recovery community organization or having some system change because we've got a few different organizations or pieces of this recovery-oriented system of care that are operating in silos, and we want to make some fast, rapid change. Instead of us coming in and just having meeting after meeting, month after month, what can we do to make some drastic change quickly? And so we're going to take you through a broad approach of how we tend to do this work and how you could maybe think of adapting it to whatever it is that you want to inquire about, whether it's with yourself personally or with your own organization or within your local community. So right back to the PowerPoint real quick. I just want to reiterate what Jean shared. This is an important piece when we're defining ourselves. When you're surrounded by people who share a passionate commitment around a common purpose, anything is possible. I feel that way about the people that I work with, and overall the Georgia recovery community. We're going to jump into this purpose question next, and I'll explain that real quick, what it is. And I guess maybe first I can share some of my purpose. I know you heard me share my introduction, and a big piece of my purpose is my son, Henry, so that he knows that, you know, that he sees what I get to do, and he gets to come with me in some different times and meeting folks, whether that's at the Capitol or all over different corners of the state, and to know that recovery is possible. So if he's ever in a situation where he may have more opportunities than I had, or at least I knew about, to get well and stay well. Another piece of my purpose is for the hope that more people don't have to die. Like here, this is a picture of me and my best friend of 20 years, Jarrett Jennings. Loved him dearly, but he lost his life due to opioid overdose on September 3rd of 2021. And so, you know, I have that picture to remember him by, and his mom gave me some of his ashes too. And so that's part of my purpose, is that I want to help make effective change in this world so that more people don't have to die like Jarrett did. More people can get and stay well like I did. And whatever we can do to help break down barriers and stigma to make that possible is what I want to focus on. So at this time, like Emily stated, hopefully you have a pen or a pad, or maybe you printed out the workbook if you were able to. But what we're going to do is we're going to answer a question. And I'd like for you to think about this. So what it is about helping to shape the future. Now, we were gearing this towards recovery community organizations. If you're not a part of a RCO, or maybe you're a part of, like, I see Dr. Noreen on here from Colorado about building up the recovery friendly workplace initiative in your state, whatever it is, what is it about helping shape the future for recovery that gives you a deep sense of purpose, meaning, and fulfillment? Now, this is for yourself personally, for your organization, for your community, and then for the world. So try to answer each of those different pieces. And we're going to give you about 5, maybe 6 or 7 minutes. We'll see. We'll try to gauge who's done by looking at your camera. So we're going to give you the opportunity to, again, write that out. So let me just, if you would like me to keep that up there, I'll keep it up there just for the sake of it. And we'll give you about 5-6 minutes to write that out. So at about 1:53, we'll check in on you. Sharing. If anyone wants to feel like sharing, I'm going to go ahead and stop. I know we kind of get to a stopping point at this moment, and maybe you could be willing, if you would like, to share your personal purpose for being here, for helping to shape the recovery community, for yourself personally, for the community, for the world. We get any virtual hands start popping up. All right, we got a few. Awesome. We'll start with Robin, and then David, and then Christine.
Hi, everyone. So for my personal purpose, I lost my 27-year-old son to an overdose in 2011. And I don't want to see others go through the grief that our family has gone through, and me as a mother. I don't like to see other people go through the kind of grief that I've been through. For our organization, Honor Roan of Roanoke Valley is a peer-run, completely peer-run center. Thank you, everyone. So we've heard people that have come to us, and my colleague Jessica King is on here too. We've heard people come to us and say that we've saved their lives and that they don't know where they'd be without us. And so it just continually fuels us and energizes us to keep going and keep offering as much as we can in our peer support organization. For the community, it's needed. It's so needed. Daily peer support is needed, and that's what we have, daily peer support. And we try to be a light. And as far as the world goes, it kind of extends out to the world, because there's kind of a philosophy, each one reach one. So if we have recovery, if we can just reach one other person, and that person becomes a person in recovery, maybe they can reach one other person, and it could just expand out. And we want recovery to be a fragrance of hope to people who have lost hope. So that's it in a nutshell.
Thank you so much, Robin. Before we jump right over to David, I just want to say thank you. And if everyone else, I see a lot of folks, y'all want to share some love for Robin in the chat for sharing with us from your heart. Appreciate that.
Thank you.
David, did you still like to share?
Yeah.
Go ahead.
Yeah. Thank you, Robin. Thank you, Brian. It's nice to see everybody today. I'll say this: my purpose is simple. I mean, I'm somebody that had my child died while I was the one out there using drugs and running the streets and going back and forth to jail to support my drug habit. My son ended up dying while I was in the process of my addiction. And that happened to be the traumatic experience for me that catapulted me, or let's say the catalyst for my recovery. And so my purpose is making sure that if I can help somebody not experience that, making promises to their child that they're going to get better, it's going to get better, and keep doing the same thing over and over again, expecting a different result. Yeah, I don't want anybody else to have to go through that and live with those promises that they can't fulfill because that child is no longer here. Change. So what I've done, taking charge, what I do, take charge of the culture of the organization that I work for by making them recovery aware. See, I bring recovery to the place that I go. Wherever I go, there it is, because it's wherever I go. I don't go anywhere without it. Why? Because it's a part of the life that I live. I honestly believe that, once a person, it says if a person's, when a person gets in recovery, I believe once a person steps in recovery, they never step out. And even if they have used, or even if they relapsed, they never go to I don't think that they actually go to the extent, they only go to so far, but they have some recovery in them, because recovery comes from within. So if recovery is within you, you've always got it. It's just utilizing what you got in you. So I honestly think that I take that culture of recovery where I go, build leadership in the community by establishing allies, helping to change policies by being a part of the Mental Health Recovery Services Board of Lucas County, being a board trustee and helping to make the decisions that will help cultivate and drive the next generation in seeing that recovery is possible for people. And I sow seeds of hope. I sow macro seeds of hope to try to change, to try to assist in changing the world, because I believe that I am somebody who has experienced two lives in one lifetime, because I truly believe I recovered from a seamless, hopeless state of mind and body. And I believe a lot of other people have done the same. It's just the point about pulling that veil of anonymity back and let us speak out. And that's mine.
Awesome. Thank you so much, David. That was great. Y'all share some love for David in the chat, and let you know that they can be proud of who you are today. That's for sure. Real quickly, we're going to just go with Yoko, and then Johanna and Carrie, and we'll try to keep those shares under 2 minutes if you can. Yoko?
Hi, everybody. My name is Yoko Nakembe. I'm a peer recovery specialist in the Virginia area, Northern Virginia area. And I think that for my personal reason for doing the peer recovery work is to just remember that is to keep reminding myself that I'm not alone in this journey, that this is not an isolated incident, but other people are also going through the same types of struggles and situations. When I think about how it affects the organization, is definitely to build a movement and collaborate with other people. And, that organization, not just keeping it within, but collaborating with other people. And in terms of community, I would like the community to embrace wellness, because I think a healthy community becomes a safer community, more involved in community affairs and things like that. And finally, with the world, we have to remember that peer recovery is not something that's just isolated to our border. We can expand it. I'm originally from East Africa, Tanzania, and no one is immune from these types of challenges. Thank you.
Thank you so much. Real quickly, Johanna, Carrie, and then Christine.
Good morning. Well, it's afternoon now, right? So personally, I'm a person in long-term recovery, and so I have lived experience. So for me, it's about not giving up on people and being able to give back what was so freely given to me, and being able to pay it forward, right? And I think of myself now as a dopeless hope fiend. I love, I forgot his name. I think it was David that was talking about, instilling that hope. That's like the number one thing that really, I think, helps people. And as an organization, I work for the Recovery Alliance. I'm in El Paso, Texas, and they've been around for about 25 years. And much like the story of Georgia, they started, one person, and now here we are, like all these years later. It's a recovery center, residential. But about 3-4 years ago, we started a harm reduction center, and that's where I came in. And so we do outreach and stuff like that. And so it's always growing, moving forward. So I just really want to remain a part of that yeah, just make sure like it's sustainable and it keeps growing, right? And I think that's all I have other than, I think it's about smashing stigma. And I had a similar story as far as I used to work for the county and I used to hear those people all the time. And so I really had to keep my anonymity. I wasn't that brave. So anyway, I think that's it. That's all I have. Thank you.
Thank you so much. Carrie?
Hi, my name is Carrie McCallum, and I'm a recovery specialist in Massachusetts. I work with pregnant and postpartum women. And what about this? I didn't have purpose before. I didn't have meaning. And this work has given that to me. In active addiction, I lost custody of my children to the department, and it was a very isolating experience. And just the impact of peer support had on me and the impact I see that it has on others, any work I can do to show how important that is and help other women not have to feel the feelings I went through. And now I have custody back of my children and, they're my other purpose. So just continuing on this journey for them and to help others, because I don't think people realize when helping others helps, us so much. It really just makes all the difference. Thanks, everybody.
Thank you, Carrie. And Christine?
Hi, I'm a peer recovery support specialist, and I was just wanted to share that I'd like to share my story of addiction and mental health issues so that others don't feel so much alone. And kind of like what I believe it was Joanna said, I'm a hope dealer, and I try to dish out a bunch of hope and make sure that everybody knows that they're here for a purpose. Thank you.
Thank you, Christine. Thank you to everyone that shared. I'm just going to say thank you again in the chat. And if you feel like dropping any information about yourself or your personal organization, if you want to get connected with any of these folks, because there's amazing people from over this call, feel free to drop your stuff in the chat. And it looks like you might have the ability to save the chat. You hit those 3 little dots down at the bottom in case there's anything good that you want to keep from that as well. So we're running out of time already and we got to keep rolling. But it's so important that we stick to knowing and keeping it in the forefront of our mind why we're doing what we're doing, because it's easy to get bogged down in the minutia and the everyday like repetitiveness of the work that we do and the busyness. But we have to stay true to ourselves, our purpose, and our mission as we move forward in this work. And so continuing to always bring that forward first and foremost. When I was taught a little bit more about this appreciative inquiry approach, we always start with the heart. We always start with our purpose, and then we move forward in doing this work. Okay, so
Ready.
jumping right into the next piece, we're about to journal a high point story and talk about some strengths. We'll talk about more of the strengths next time, but we're going to do a little bit of journaling this high point story right now, okay? So what we'll first do is, and we saved a little bit of time by not jumping everybody into those breakout rooms initially and just sharing from on a large group share. So what we'll do is, if you are following along in the workbook and you scroll down past connecting to the purpose, boom, don't worry about the small group conversations. We're going to jump deeper into that next time. But for today, what we're going to do is talk about this high point story. Okay, so and this might not be, again, for a recovery community organization, you might not be connected with one, and that's okay. But if you could just think for a moment when you've experienced utilizing recovery support services, when has that been at its best and most powerfully impacting a peer, yourself, or the community? Now, again, this could be your experience or someone else's, but what made it an amazing experience? What did you bring, or what did that peer bring to this moment that helped it thrive? And if you can, try to describe it in as much detail as possible. So what we'll do is just give you about, let's say about 4 to 5 minutes to journal out this opportunity. And then we're going to go into groups where we'll share. And I'll give you a little bit more details after we finish our journaling session. So here, I'll drop that in the chat. Again, you may not be a part or connected with a recovery community organization, but you're obviously connected with a recovery in some way. And so how has an experience that you've witnessed helped be most impactful for a peer or yourself? So again, we'll give you a little bit of inspiration music here to go along with this too. We're actually cutting close on time. So just for the sake of that, we're going to give you about 60 seconds left and then jump right into our group share. All right, let's start wrapping it up. Try to find a closing point. If you're not quite done yet, hopefully you at least have that experience or your story in mind so that when we jump into these breakout rooms in a moment, that you'll just be ready to go, because we have to be quick and efficient with this. It's 2:10 and we're trying to wrap up by 2:30. So what we're going to do is first, you want to select, hopefully y'all can see this. Adjust it. We're going to find in your group, just have someone to keep time. And then we're going to share. And what we're going to try to do is share in less than, ideally, you can share in 60 seconds. Okay. So 60 seconds, right? And whoops, there we go. And then after that, we're going to choose up a top story. Let me adjust that choose up a top story that you maybe want to share as a large group when we report out. Now, there's a lot of groups, okay? There is a lot of groups, and we're not going to be able to hear from everybody. We may be able to hear from 2, 3, possibly 4 if we're able to do this quickly and efficiently. And then lastly, we're going to talk more about this, and this will move into the next session, but just listen for some of those strengths, okay? Try to remember or recall, and if you want to write down a few of them, feel free to do so, okay? So Emily's got us lined up and set up and to go into groups. So remember, we're just going to try to find someone to keep time, keep us on point, because we're only going to have about 10 minutes total. So we're giving you a little extra time. It's going to be about groups of 4 or 5. We're going to share for 60 seconds, approximately. A little over, that's okay. A little right on point would be better. A little less is even best. All right, choose up a top story and listen for those strengths. Emily?
Here we
Yeah,
go.
you got them prepped, ready to go. All you
Yes,
have to do is, I think, choose, select to join the room. When that option is hit, boom. So there's not enough time.
Christine's got her hand up. Let's see how.
We're still waiting on
Some folks.
some folks, and boom, 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 boom. Here they come.
Great.
Guys, I know that y'all probably are saying to yourselves that was not enough time. Somebody was mid-sharing, trying to get whatever it was out. And we know that that's generally how this operates, but hopefully some good stuff was shared. And we would love to hear from 2 or 3 groups.
2.
2, maybe 3. We'll see. We need a couple of virtual hands to pop up. And if y'all weren't able to choose or have the time to select, hey, this was a story. If you really, really, really want to share what you shared, or someone else shared, feel free, please. We got Christine, and if there's another group that would like to share as well. Christine, you want to go ahead?
I was just raising my hand for Kathy to share.
Okay.
Awesome.
Great.
Kathy, are you willing?
I was raising my hand because I wanted to share. So there you go. And I pushed.
All right, Kathy.
Are you ready?
Yeah.
So this is a story of strength. I was going to the local mental health hospital for peer recovery support services, and I met Natalie. She was in liver failure, and it's a little emotional. And I had been served with divorce papers. Her husband had left with her 2 sons. I began to support her through this. Her hope was getting better and maintaining her recovery, getting her family back and maintaining her career as a nurse. I supported her through all of these areas in so many different ways, even doing advocacy with her attorney, her husband, his family about what this disease is. Now, she has gone back to work at our local hospital, back with her family, and still coming here 20 months later to Walton Empowers, which is a recovery community organization for peer support services. She has taken our Respect Institute, which is in Georgia, what we use to learn how to tell our story correctly and in a small amount of time, and has spoken at several of our events. So that's her story and my story of hope.
Awesome. Thank you so much. We really appreciate that. I don't know if y'all were listening. I heard a lot of different strengths that were shared. Just a couple of them that stood out to me was support, resilience, dedication, and willingness. If you feel like dropping it in the chat, anything that you heard from your own stories or from your group, feel free to do so.
And that's part of your homework too.
Yeah.
So just keep that in mind. You'll get a jump start on your homework.
Olivia, if you'd like to share.
Sure. I work in research. So I had previously worked in direct patient care in a hospital setting, but now work more with numbers. And I was at a strategic planning event this past summer for the Upper Midwest Rural Opioid Response Network. And they invited a participant of their program to share her success story. She was a young adult. She is in college now, but she had started using with her mom probably when she was about 13 years old. And a lot of other programs had kind of written her off as she's just never going to be able to be successful. She's just kind of stuck in this rut. And one of the local rural clinics took her into their program, and she has been extremely successful. She's now in college and going to get her psychology degree with the goal of helping other people in her situation. And it was, for me, it was a really grounding experience to be able to hear somebody's story and remind myself that, you know, the numbers are important, but these are people's lives and these are people's stories. And she was also great at sharing what worked and what didn't work, and had so much confidence for somebody who was in her early 20s to be able to share her experience with, you know, physicians, leaders in the hospital, and just did a marvelous job. So that was a really an eye-opening experience for me in that moment.
Awesome. Thank you so much. I'm going to do it. I'm sorry, Emily, real quick, real quick, Carrie.
Okay. So I am a mom to 2 young kids. I work full time, but I volunteer at our local RCO to do a group for moms in recovery, which a lot don't have custody of their kids and are low income. So Christmas time can be not as joyous as it should be, right? So out of nowhere, I had an acquaintance of mine reach out because she knew the work I was doing. She works at a local hospice, and they had wanted to find a small group that they could, you know, sponsor for Christmas. So I was able to coordinate with them to get Christmas gifts for all the moms for their kids. And, you know, some of these moms don't even get to spend Christmas with their children. And I mean, my schedule was very busy, but, you know, I made the time so I could bring a little joy to these families at the holiday time. So that was really powerful. Thank you.
I love it. Thank you. Thank you for sharing. I heard some love, giving, joy. There's some beautiful, beautiful stuff. And I'm sure that y'all all had some great things that you heard in your groups. And I hope that you're able to carry these forward and join us. Please join us next time, because that's where we really take some deeper next steps. And Emily's about to share a little bit of what we would like for you to bring back next time.
Yeah, so thank you, everyone. And we want to be really respectful of your time because we really appreciate you guys being here with us. So I'm going to go back to our agenda. Hopefully you guys can see it. If you can, I can make it larger, but I just want to briefly touch on the homework assignment. What we'd like for you guys to do is consider the stories that you've just talked about. But first, what we want you to do is think about, in terms of your organization and personally, what will you not support? And there's an absolute reason for this, because, you know, we talk about how we start everything with what's working and strengths and everything. But where do strengths come from, and where do core values come from? Core values really come from the anti of what you won't tolerate, right? So if I won't tolerate someone who's lying and stealing, and I won't tolerate that kind of behavior ever in my life or in my professional life, personal life. I have integrity today. Today, I live my life, you know, open, and I don't have to live in the shadows. I don't steal from people. I value integrity. Integrity is really important to me. It's one of the CARE's core values. And it's just super important to my recovery. So just start to think. That's why we're asking you to start to think about what you will not tolerate, because you can flip that and turn it into a core value for yourself and for your organization. So really give yourself some time to sit down and think about what you will not support, you know. And if anyone has any questions about that, I gave you some examples here of what our CARE's core values are. And I guess, Brian, are you sharing your screen?
Yeah,
now?
I did. I took it was a little larger on the homework.
Could you scroll down a little bit so we could see the core values down there? Just a little bit down.
Can you
please.
see?
So the other thing then we want to ask you to do is go back and think about, again, what Brian was sharing, the organizational core strengths. So the information will be found in your high point stories, and we want you to come thinking about how we're going to engage in group discussion, just like what we just did, but we'll do it on a larger scale. And we'll give you some more time when we meet again. It won't be so much of the didactic sharing from Georgia Council. It's going to be you guys doing this work. Really, that first intro, we're not going to have all that. We're going to dive right into the work. So you guys are going to be doing all the heavy lifting on the 16th, but that's what you're here for, to learn from each other and learn what works. But again, the CARES Core values, just as an example, are in your workbook. If anybody needs a copy of the workbook, let us know, let Nell know, let Cindy know, and we'll make sure that you get a copy of that. And at this time, does anyone have any questions? And thank you. Nell or Cindy?
Yes. Cindy, can you throw the evaluation link in the
We're gonna-
chat?
We're going to do that at the end of the second session.
Oh, we
Make
are.
sure
Okay.
folks- Yeah.
Okay. So I noticed that there are a couple of people in the chat asking for a copy of the chat. Is that possible?
We have it if everybody on is okay with that. It has all their remarks in it, but I can definitely send it out. I know it has the links to the resources that Emily mentioned, but we're also going to have all of that again, that landing page that I just put a link in for. It's going to have everything for this whole series, not just February. It's a private page, but you're all able to access everything on it, including the recording of this session and others, which will be posted by tomorrow.
I'm
Okay?
sorry we ran over. We won't run over.
Oh gosh, I'm so upset. This was amazing. This is a perk of my job. I get to sit in and listen to all of you awesome people. And as a person in recovery myself, I love it. It's wonderful work. So,
This was great. Thank you all so much.
Thank you.
Please come back for the second session, and we'll see you next time. Thanks.
Bye, everyone. Thank you.
Thanks.
Karen.
Bye.
Thank you, Cindy. Thank you, Brian. Bye, everybody.